Emily.
And I noticed your name's Emily Miller. May I call you, or what would you like to be called?
Emily sounds good, thanks.
Okay, awesome. Emily, what brings you here today?
I have some yellow stuff coming out of my eyes.
Yes, I see from both eyes, so I'm going to examine that, but I'm going to ask you some questions about yourself first. How old are you?
I'm 22.
And are you married? Or
I am married.
And do you have any kids?
No kids yet.
And any pets?
Not yet.
And what's your occupation?
I'm a receptionist.
And how do you like that?
I love it.
Awesome. So, when did this discharge begin?
About 5 to 7 days ago.
And can you describe it? Is there any pain?
No pain. When I wake up, it's all goopy and I just can't handle it.
Yeah. And is there anything that makes it better, like relieves it?
I put a warm cloth on it, but that's it.
And anything that makes it worse?
No.
And is there any pain or itchiness related to this, or
No.
like I would say, like if you can rate it from 0 to 10?
Maybe 2 or 3.
2 or 3, okay. And I'm just gonna ask you, before I do a physical examination, I'm gonna ask you some questions. Now I do notice that you told our receptionist that you're just getting over a cold, or you might still have some symptoms. So I'll just examine your whole ears, nose, and throat. So any pain, like you mentioned, you don't like the pain's 2 out of 3. Any blurriness with your vision?
No.
Or any change in your vision?
No.
And so regarding your ears, do you have any, like, are they plugged? Any hearing issues?
No.
Any external pain here on the outside of your ears?
No.
Or inside?
No.
Any discharge?
No.
And regarding your nose, is there any discharge from your nose?
No.
Or any pain in your nose?
No.
And do you find that you're able to smell everything fine?
Yeah. No.
No? And regarding your throat, do you have any pain in your throat?
No.
No? Or are, no pain, okay, that's good. Or your mouth, teeth, any issues with your teeth?
No.
No? Okay, that's good. And like for your sinuses, any swelling in your sinuses?
No.
And these are called lymph nodes. They're all over your face and your any like swelling behind your ears or on your neck, anything like that you're experiencing?
No.
Now I'm just gonna ask in general, family history. Any significant family history with your mom, on your mom's side, or your mom?
No.
Or your dad? For example, it could be hypertension or seasonal allergies or anything like that.
No.
Or not? Okay, that's good. And now, have you had any, for yourself, regarding yourself, have you had any surgery?
No.
And also, are you on any medication?
No.
Prescription or vitamins? Do you take any vitamins?
No.
No vitamins, okay. Or supplements? No? Or no? Okay. So now regarding, I'm just going to ask you about your cardiac system. Any issues with your heart, palpitations, or any pain, or
No.
no? And regarding your lungs, any issues being short of breath, or you mentioned you don't have any outstanding medical things like asthma or anything like that?
No. None of them.
Okay, and regarding your gastrointestinal system, any issues with your stomach or bowel movements or intolerances to food or bloating?
No,
And regarding your genital urinary system, any issues with your bladder or burning when you urinate or anything related to that, like your bladder?
no,
No? Okay. And your musculoskeletal, any pain in your muscles or anything related to like your bones or any issues with that?
no.
And okay, so that sounds really like you're a very healthy person. So I'm just gonna check. I'm gonna stand up and go. I'm gonna tell you what I'm gonna do. So I'm gonna take your vitals. I'm gonna take your pulse, and I'm gonna take your blood pressure. I'm gonna take your temperature. I'm gonna count your respirations. And then I noted that your pain, which is the sixth vital sign, was between 2 and 3. And your SpO2 is also within range and unremarkable. So now I'm going to check your eyes, okay? So I'm going to just shine a light and just look in your eyes. And I see that your sclera is white. Your iris is light greenish, brownish hazel. Actually, it's hazel. And you have a normal distribution of hair on your eyebrows and your eyelids, but there is some yellowish discharge present. So look at this light here, and what I'm noticing is if both eyes are equal and reactive to light and accommodation. So when I shine this one, people will also constrict. And now look at this and follow this, okay? And look up, and I can see that everything is intact in terms of that. Your nose is midline, and your eyes are bilaterally symmetrical. Now, if you lift your head up a little bit, I can look in your nose, and your mucosa just very light pink. Your septum is midline. Everything looks clear and fine. If I look at your ears, and I'm just going to palpate around your eyes. Any pain or tenderness there?
No.
Okay, I'm just going to touch your ears. Any pain or tenderness when I touch your ears?
No.
Okay, and I'm just going to look in your ear. So I'm going to lift it and look inside, lift and back, and I'm going to see that I can see it's clear, and that your the cone of light is at 7 o'clock, and that your eardrum is pearly white there, and I can see it. And this one too, I'm going to lift and pull back, and I can see your eardrum, and I can see the cone of light is at 11. Okay, and now I'm going to just palpate, because you're just getting over a cold. I just want to make sure it's not a worse infection. I'm going to touch your sinuses and just see, do you have any pain there?
No.
No, okay. And now I'm just going to check your lymph nodes. So these are the occipital, and tell me if you feel any pain, and I'm going to see if they're enlarged or not. So occipital, periauricular, postauricular, tonsillar, submaxillar, submental, and postauricular, cervical chain, deep cervical chain, and any pain or on palpation?
No.
Okay, so I'm just further examining your eyelids, and I believe that you have bacterial blepharitis. So what I'm going to do is I'm going to prescribe erythromycin ointment for 7 days, BID. So that means you put it on in the morning and then you put it on at night, okay? And in between, if you are feeling discomfort, you can do what you were doing. So that was right, to put a nice warm cloth on there, and that may relieve some of the pain or take away some of that discharge. Okay, and if you do not have relief in 7 days, or if your cold symptoms kind of come back in that time as well, to give our office a call, okay? And we will see you again, and we will further, look after you. So do you have any questions for me?
No.
Okay, thanks so much again, Emily, for coming to see us today for me. And have a great day.
Thank you.